Brain surgery, and for that matter spine surgery, has really focused over the last several years on what's called minimal access surgery. For me, it's incredibly satisfying to have people like Dr. Schwartz and Dr. Anand be a part of the department. It is the framework upon which I built this department. We tried to create an environment for thought leaders. The department itself has invested in the creation of the Surgical Innovations Lab, which allows people like Dr. Schwartz and Anand to go practice on materials and then take that translationally to the bedside. The fact that Ted and Vijay are invited around the world to give talks is satisfying for both the department and for me personally that we've been able to achieve this. It has helped change the way we're thinking about the surgical management of pituitary tumors. That's why we're here.
I've been performing endoscopic sinus and nasal surgery for a little more than 25 years. It took me about 17 years to finally find a neurosurgical partner. Initially, when I explained this procedure to the neurosurgical chairman, his response was, "I have an excellent neurosurgical attending who is very interested in this approach. I'd like to introduce you to Dr. Schwartz." And it immediately clicked.
I was really just lucky to be in the right place at the right time, to have good mentors and people around me. And I credit Phil Stieg for really pushing me to investigate endoscopy, and Vijay Anand with really teaching me how to use an endoscope up the nose.
We have the same thought process. We are always on the outlook to make sure that the patients have an excellent result. And we have the academic interest in publication. And Ted, I think, is a unique neurosurgeon who has the ability not only to operate but be passionate about his work and compassionate to the patients.
When you operate with a microscope, you really can't see very much because a microscope is a huge instrument and you can't really get it up the nose, and your field of view is very limited. And when we take an endoscope, we basically can put the endoscope up the nostrils and look around and seeing all the anatomy that we never really could see before when we did it with a microscope.
My eyesight had started deteriorating. I had noticed that I had difficulty, going. I'm a big baseball fan, going to the ballpark. Couldn't see the scoreboard, couldn't read the scoreboard. Thought at first it was just something that I could go and get my glasses changed. So I saw an ophthalmologist, I saw a neuro-ophthalmology, a retina specialist, and they all told me that, there was some other things going on. After I had, got recommended to come to Dr. Schwartz, and when he sat down with me, he told me that that you had a pituitary tumor, and that was causing your vision loss. So it was very scary.
Indeed, he had a pretty big tumor, and his optic nerves were just squished by this tumor. And so, we went through with him the details of the surgery, but really felt wonderful that we could offer him the opportunity to cure his visual loss. And in fact, he came back in, a couple of weeks later, and he's like, "Doc, my vision's so much better now."
But even now, without my glasses, I can see a lot better. Really the surgery really improved my sight tremendously.
My initial symptoms were migraines. Horrible migraines, chronic migraines. I was having them for 3 to 5 days at a time. My hormone levels were extremely elevated, and I was just sick, all around sick.
Amanda was a different situation. Her tumor was a hormone-producing tumor. It was making prolactin. And the pituitary gland makes a number of different hormones, and prolactin is one of them. And in women who have prolactin-producing tumors, they stop menstruating.
He told me right when he looked at my MRIs that he wanted me to come in for surgery. I think my parents were more scared than I was, but knowing he could do a surgery that would have been so invasive and so life-changing, because I would have had a craniotomy and been open from ear to ear, knowing that he can go through my nose and do it endoscopically where there would be no scars was incredible to me. So I ended up coming in the following Tuesday and having the surgery done. After my surgery, they did a full panel of blood work, and my hormone levels went from double of what they should have been to perfectly normal. So, he definitely did the job and did it well.
It's a great team, great doctors, great staff, which is super. It worked out well.
It's so rewarding to treat patients with benign pituitary tumors for that reason, because you can cure them and restore their vision and contribute to their ongoing happiness for the rest of their lives.
I have nothing wrong with me now. I'm feeling good. I have no symptoms.
The impact we have on our patients is really the food that nourishes us, and keeps us coming back, every day, and drives us to create new treatments and to innovate in ways that will not only push the field forward, but really have an impact on people's lives.